Hey guys, so today we're going to be talking about distributive shock, which is when small arterioles or small venules become dilated. And with them being dilated, the blood will pool up in our bodies, having our bodies to have poor perfusion. And then our bodies will also have a high cardio output, which will mean that the pumping of our heart is going to be much higher than usual. And in distributive shock, there's also four main types, which are septic, neurogenic, anaphylactic, and psychogenic. So, septic shock is also known as sepsis, and this is caused by an infection that releases bacteria or toxins into our blood. And the people who have sepsis or septic, however you prefer to say it, will often have a fever, or they'll be nauseous, they'll be vomiting, tachycardia, a low blood pressure. Their skin will be kind of warm. And in order to treat this, you are able to transport them as soon as possible. And you're going to want to put them on a high flow of oxygen. And you're going to want to put a blanket around them in order to conserve their heat. And you're also going to want to assist them with their ventilations with like a big valve mask, or, well, you're already supplying them with some oxygen that you could do. Going on to neurogenic shock is caused by a high spinal cord injury, and these people will often have a slow pulse. They will have low blood pressures, and they could have a possible neck injury due to the spine being injured. Ways that we could also treat this is maintaining their airway, and you're going to want to immobilize their spine due to their high spinal cord injury, and you're going to also want to conserve their body heat. In the body, it often needs help with the blood cells, so by giving them oxygen, it can help give the extra oxygen with the carbon dioxide to convert our body to have that better perfusion and everything. And depending on whether the transport's long or not, you can also consider the ALS once more. Anaphylactic shock. That is a very life-threatening one. And that's more of an allergic reaction, and you can get them from bee stings, peanuts, some people are allergic to ginger, and anything else that people could possibly be allergic to. And when an anaphylactic shock happens, our body releases histamine, and histamine goes into our blood, and it increases the permeability in vessels. So some signs that you'll be seeing is that this shock happens within seconds. The people can have itching or like a rash look to them. The skin could have also that burning skin kind of deal, a vascular edema. The person could be in coma, or even the person could have a rapid death. So we're going to want to manage their airway again. We're going to want to supply them oxygen, determine the cause of what happened, how they got this anaphylactic shock. As emergency medical technicians, we are allowed to administer epinephrine. So you can help them with their auto injectors, or we can give them 0.3 milligrams of epinephrine. And we can also transport them. And then once again, we can also consider that ALS. Lastly, with psychogenic shock, this is going to be a sudden reaction to the nervous system, and they're going to create that temporary dilation or even a faint. And this often happens when people have anxiety, bad news, site of an injury, blood, and these people often have rapid pulses and from normal to really low blood pressures. And in order to treat psychogenic people, we're going to want to keep the person in a supine position, record vital signs, and keep track of that mental status. And we're also going to have to suspect that these people could have a possible head injury if they could be fainting. And that is all about distributive shock. And thanks, guys.